everyone, I'm Dr. Brooke Rothstein, one of the dermatologists at AboutSkin Dermatology. I'm so excited to have you all here tonight for our live webinar discussing Sculptra. And at the end, we encourage you to stay through the whole video so we can answer questions at the end in the questions tab. You can just write them in there and we can answer them live. We also wanted to let you know that we're going to be doing a promo, so anyone who books a Sculptra visit, we're doing a promo between now and the end of October. We'll be honoring a discount where it's buy 3, get the 4th vial free. So we look forward to talking to you today and answering all your questions.
Sculptra is a biostimulator implant containing particles of PLLA, or poly-L-lactic acid. It's biodegradable and biocompatible. It's a polymer that helps replace lost collagen. Once injected, fibroblast cells are attracted to the PLLA. They make an inflammatory response, creating type 1 and type 3 collagen. So with Sculptra, we are trying to produce more collagen to make our skin look better. So it's helping thicken up the dermis of the skin, lift tissues, create volume, and create a glow in the skin. So on-label treatment areas as of 2021 with the FDA indication: cheek wrinkles, nasolabial folds, marionette, preauricular wrinkles, and chin wrinkles. So what other areas can we treat with Sculptra that are not FDA approved? We can treat scars on the face and on the body. We can treat temples. We can treat jawline, neck. We can treat the décolleté. We can treat crepey skin on the thighs, on the arms. Really anywhere you want to thicken up the skin, give the skin a glow, and then create volume in areas. Tara is 51 years old. And she is a runner. So when we run, it's hard on the fat pads on her face. The other thing is she is not the greatest with sunscreen, as you can see. So sun is really, really hard on her skin. So we really want to ramp up her collagen stimulation so she can look like she has more radiant skin and more lifted tissue and less laxity. So when I look at Tara, she's got a couple things. We definitely need to treat her temples. She's getting some hollowing here. Her lateral zygoma. Now she's had Sculptra. It's been about 2 years, so we definitely need to inject her again. Lateral zygoma, which is going to lift the tissue. We need a little bit in this medial region too to kind of lift that tissue up. We need some in her nasolabial fold. She actually right here in that mandibular area, she actually looks pretty good. We want to do some back here in the jawline to pull this back. And then I'm going to do a little bit of hyperdilute, so just more than, I'm going to do about 10 cc's, and I'm going to do some in the dermis just to help with this texture here.
Thank you everyone for attending. If you stay on now, you can put any questions in the question box and we can answer them over the next 15 to 20 minutes. And don't forget about the promo, buy 3 vials of Sculptra, get 1 free. So you'll be getting a text message from our office with information about that, and then you can call to speak with one of our cosmetic coordinators and we'll get you scheduled. Hi everyone, hopefully you can all hear me. I'm just going to reintroduce myself. I'm Dr. Brooke Rothstein. I'm one of the dermatologists here at AboutSkin Dermatology. I can't see who's on this, so I don't know if you guys are my patients, if you're other patients, if you're not even a patient here, but I'm really happy to see that we have 16 people on, and maybe I know some of you or we'll meet some of you soon. We're excited to be talking about Sculptra today. I know that was sort of just a little like intro video into it. I'm sure there's different levels of familiarity with Sculptra. So there's no silly question at all. I'm happy to answer anything that comes to mind. I see there's already a few questions in the question box. So I think if you go to the questions tab, you can just write in any questions that come to mind. But essentially, just to kind of give you like a quick, brief rundown on what Sculptra is. So it gets a little bit confusing for people because when we talk about fillers, Sculptra usually falls into that category. And it's not totally fair to call Sculptra a traditional filler. So traditional fillers are hyaluronic acid. And I tell people when you squirt out a filler, I wish I had a vial to show you even, you squirt it out and it's like a jelly. You can hold it, you can touch it, you can kind of move it around. Sculptra is different. The way it works is different, and the way that it looks is different. So it actually, just to kind of show you guys, this is a vial of Sculptra, and I don't know how easily you can see, but it's actually a powder that we inject saline and some lidocaine into. So it's really more so a liquid. So if I was to squirt it out, it would kind of liquid splash. It's not something that is a gel that you can touch and hold. It's not in that kind of more solid category. So because of that, it works a little bit differently. So it's actually what we're doing with Sculptra is we're trying to get you to build your own collagen. So we are injecting it into areas where the skin is hollow, maybe more crepey, and we are trying to get your fibroblasts to build their own type 1 collagen. So as opposed to traditional filler where we say, oh, okay, we're hollow, we have a deficiency that we're trying to kind of plump up and fill in real time. Sorry, give me 1 second. I'm just going to skip that. This is, we are trying to gradually create more global improvement in skin texture, firmness, and really support the overall facial structures and kind of rebuild that collagen and the fat that we lose as we age. So it's really getting your body to build collagen. And in some ways, it's a little bit safer also than traditional filler because it's that liquid. We're not injecting a gel. The risk of hitting a blood vessel is lower. So as dermatologists, we also like the fact that we feel a little bit safer injecting it as well. We worry a little bit less about some of the complications that we can see with traditional fillers too. And the way that it works is, so this is 1 vial of Sculptra. We usually determine how much Sculptra you need at the consult, but a general rule of thumb is we go off of how old you are and so how many decades of life. So if you are 30, we would say 3 vials. If you're 44, 55 vials. And it doesn't have to be perfect, but that's generally a rule of thumb. And we don't usually do more than 2 vials in 1 session. So we would have you come in for a session, inject 1 or 2 vials, generally 2 to start. Then we would bring you back about a month or so later to do the 2nd session and or 3rd session, depending on how many vials we're doing. And in that time, you can actually start to see some of the improvement in skin quality. And even they say as early as 4 to 6 weeks, but the results are actually last up to 2 years. And I kind of think of it as like the building blocks for anti-aging with these injectable medications, because we can do a series of the Sculptra, and then anywhere else where we have some deficiencies is where we can do more of the traditional filler to try and plump in those areas where there still may be a deficit. So this is like kind of laying the groundwork and building blocks for more global improvement. We do temples, we do cheeks, jawline, nasolabial folds. So we get some really nice global improvement with Sculptra. Let me look here in the question box. So first question, what can I realistically expect in terms of volume and skin quality improvement? So like I said, we'll start to see results at about 4 to 6 weeks. And you'll see over time improvement in skin firmness and what they call like a Sculptra glow, where the skin quality just appears younger. We have that younger collagen that just makes the skin look more elastic. So it's a little bit, takes a little bit of time, but you will see more fullness. You will see improvement in hollowing and that skin quality, firmness, glow, smoothness. Will smooth out some of those wrinkles. So, it's hard to exactly quantify, but every patient who does Sculptra will see an improvement each time we do it. And that improvement continues to grow over the 2 years. What should I avoid after injections? So immediately after, I usually say avoid exercise. We just don't want to get the blood pressure up. So anytime we're doing filler injections, there's risk of bruising. That's the number one risk is bruising. So we're poking you with a needle. So I just don't want people going out and exercising, getting blood pressure up and having more bruising. So I would avoid exercise for 24 hours. You technically can apply makeup a few hours later, but I usually just say wait until the next day to apply makeup. And you can really go back to your normal skincare routine as long as you're not having any complications. And most patients don't. It's really just you may have some bruising. So with any procedure, I generally say don't book it right before an important event. Give yourself at least, a week or two for any bruising to resolve. Is there anything I can do prior to treatment to help reduce swelling and bruising? So prior to treatment, you want to avoid anything that thins the blood. So avoiding even like alcohol, actually, even like a glass of wine the night before can make you a little woozy. So trying to avoid alcohol, any blood thinners, like Advil, aspirin, it's helpful. Obviously, things happen, people take it, but it will just make you more prone to bruising. So trying to avoid. Some people will take an antihistamine before some of our, filler or laser procedures. And if you're someone who's prone to swelling, then sometimes just even like a Zyrtec, it doesn't have to be a Benadryl, doesn't have to be anything sedating, can help minimize swelling if that's something you're prone to. And afterwards, we have you ice to help reduce that swelling as well. And I would still avoid any blood thinning supplements if we can for 24 hours afterwards. We do have vitamin K serums that you can put on that also can help with bruising. So that's another option. And we can always talk about it more at a consult visit. Let's see. Oh, okay. So someone asked here about the rule of 5. So I forgot to mention that. So when we inject the Sculptra, it's this thin liquid and has all these little tiny particles in it. And we want those particles to disperse evenly within the skin. So there's something called the rule of 5s where we have you massage 5 times a day for 5 minutes for 5 days post Sculptra. And usually we say do it while you're washing your face. You can kind of use the cleanser to help guide you. It makes it a little less awkward than on dry skin. You can also do it with a moisturizer. And it's really just circle motions, and we'll show you at the time of the visit. And it helps to prevent the formation of any lumpy bumpies that can form, any nodules. They actually changed the dilution of Sculptra so in the last few years. So since they changed that dilution, the rates of nodule formation is a lot lower. Luckily, it's something that we don't have to worry about as much anymore.
but we still want people doing that massage as much as possible in that 5 days afterwards, just to reduce the possibility of it. What is expected downtime, if any, and how long do results last in general? So the downtime is really just if you have an event and you have bruising, it's really just the bruising and or swelling that can come from it. So again, I wouldn't book it. I would give yourself a week or two before any important event. I would err on the side of 2 weeks, honestly, because some people tend to bruise and it can take longer for that bruising to resolve. So that's really the main downtime. Like I said, avoiding exercise, I would say until the next day, but you can wear makeup the next day. So it's really minimal downtime. And you can pretty much go back to most of your normal life activities right away. And so the results last for 2 years. So what a lot of patients will do is they'll do this initial series where, again, we're laying that foundation, the building blocks. We're going to do that, let's say 3 to 6 vials over a series of 2 to 3 appointments. Then after that, we can, even just once a year, do like 1 vial even just for a touch up. Any areas where there's some volume deficiency, we can inject. So a lot of people still do that maintenance vial once a year, but you theoretically could do it every 2 years. And it really depends on the person, but you'll hopefully start to see the results soon, within 4 to 6 weeks of the first session. I'm wondering if you buy the 3 vials and get the 4th, do I have to use all 4 vials in one treatment session? So the way it would work is you would do probably 2 vials to start, because almost everyone does that. And then at the next session, we could do 1 or 2, depending on the person. We probably would just do it with the 4th free. We would probably do the 2 in one session and then 2 in the second session. So that's how I would plan to use it. How often do you have to do and how long does it last? Is it more natural? Can it move around in your face and cause disfiguring of any kind? Okay, good questions. So like I said, we do that initial series and kind of based on your age, skin quality, we'll come up with, is it 3 vials? Is it 6 vials? And we go through that initial series. Then, again, the results, the studies show last even at 2 years, women feel that there's more glow to their skin. They're seeing even increasing smoothness, firmness to the skin. So it's pretty amazing that it lasts that long. Is it more natural? Yes. So I think that the old days of filler we were just talking about this, all the funny looking celebrities whose cheeks, were huge and, the lips are huge, and we never inject Sculptra in the lips, but no one wants that. I don't want that. I don't want my patients going around looking like that. So that's really important to me that no one leaves my clinic looking funny. And really the goal is for people to look at you and say, oh, she looks refreshed. Her skin looks good. We don't want anyone thinking, what did you have done? So it is natural. It's essentially adding this. So cheeks is a really common place where we put it because as we get older, we actually get fat resorption in our face, and we get it globally, but we get it in our face. And so here we see a lot of hollowing. So this is where Sculptra actually initially started, was in the cheeks for when we see what's called lipoatrophy. We lose that fat. So we want to regain some of that fullness so that we look less tired, less gaunt. But we're not trying to puff things up. We are just trying to smooth, round out, and fill in some of the facial hollowing, essentially. So it is theoretically more natural, and it's derived from like beetroot sugar. So it's interesting how they make it. And can it move around in your face and cause disfiguring of any kind? So it's not like traditional filler, again, where we see filler migration over time. Like, for instance, I basically don't do filler under the eyes anymore. That filler does tend to migrate. And then we see actually later swelling and filler nodules around the eyes. And same actually with sometimes in the lips, we see it moving around. This is not like this, that this is out of your system in 9 months. And it's really, think of it as a liquid that's going to intercalate into the tissue where we inject it. And then we do that massage to kind of smooth it out. We are not just putting it into one spot and then it can move. It's kind of going all into the surrounding tissue. We put it into the dermis, which is the second layer of skin, and sometimes a little bit deeper than that too. But we don't worry about migration with it. So really disfiguring, no. The nodule formation is a real side effect of it, but it really, with these new dilutions where we're diluting it more than they used to traditionally dilute it, even the nodules is much lower risk than when you say disfiguring. No. Let's see. Since the substance is different from filler, would it be more painful or less painful than traditional filler? So into this vial, we inject saline and lidocaine. So there is lidocaine in the solution itself. So as we inject, you get number, and we still sometimes do topical numbing anyway, just to make people more comfortable. I find that people do pretty well with Sculptra in terms of pain. What we're generally doing is I'm picking a few entry points and I'm kind of fanning it out like this, and we kind of cross hatch it. And because it's so liquidy and that anesthesia sort of starts to kind of fill the general area, people do pretty well, and it's easy to push because it's a liquid. So filler sometimes is a little awkward because you're kind of pushing out a gel. I don't want to say one is necessarily more painful than the other, but usually patients don't complain to me that it was super painful. I haven't really heard that, and generally people are pretty comfortable. Yeah, okay. Also, with other fillers, I know they can migrate to other places. Does Sculptra also have the possibility to migrate? Really, again, not in the same way, because it is a liquid that's it's really getting your own body to create collagen. Whereas with traditional filler, I'm injecting a substance, and let's say I'm putting it right here. I am injecting basically a gel, and that gel can move, and we don't have control over where it goes. This is really a liquid, and when you leave, you're actually kind of swollen. Sometimes people like the way it looks in a way because we have that volume immediately. So you leave, you're going to be a little puffy and swollen, but then within a day or two, that puffiness comes down, and we're just really relying on the Sculptra particles at that point to get your fibroblasts to build collagen. So it's not me injecting a gel substance that sits there and then can move over time. So no, we don't worry about migration in the same way. How long has this been FDA approved? So I think it first got FDA approval in 2003. I think it's approximately that time. And actually it was, like I said before, it was initially approved for HIV lipoatrophy. So when it first came out, they were using it for patients with HIV who were suffering from very real fat volume loss. Then over time, dermatologists started saying, hey, we can use this off-label in other ways. So it was being used off-label. Now, in the last few years, it received an on-label FDA approval for places in the face for non-HIV patients. So for anyone who has any form of fatty loss in the face, it's now FDA approved for in the last few years, maybe 3 to 4 years. But it's been used since, again, over 20 years now. Side effect wise, it's again, so bruising, number one, pain with injection, right? These are needles. I wish I could make this pain free, but I can't. So there may be some pain, but it's usually pretty tolerable. But those are the two most common things that we worry about. The nodule formation, like I spoke about, it used to be more prevalent. Again, now that they changed the dilution, so it's a thinner product that we're injecting, we worry less about the nodules, but it is still a real risk. You have to do that massage. We really want to get that product to stay intercalated within the tissue, and we don't want any lumpy bumpies. Anytime we're injecting anything, like a filler, a traditional filler or Sculptra, which we consider more biostimulatory agent, the biggest concern is that we're going to inject a vessel. When we inject a vessel, this is, again, extremely rare. But what can happen is you can block a vessel, and then we can block the skin that's supplied, and that skin can die and slough off and necrose. And even more rare than that is blindness, because if it gets into a vessel that supplies your eye. With Sculptra, though, our concern about causing skin necrosis or blindness our concerns are lower. We feel a little safer because it's liquid. We are much less concerned about, even if I hit a vessel, it's probably just going to go right into your bloodstream, and it's not going to cause an occlusion. Whereas if I hit a vessel with a traditional filler, the concern is it's going to block. So these are still risks that anything that is any product being injected into your face, this is a risk. And anyone who tells you otherwise is not doing their due diligence. It's important that people understand that these are real risks, but there are techniques that we use to help mitigate these risks. So you want to make sure you have an injector who knows what they're doing, who understands facial anatomy, to avoid blood vessels, essentially. But again, these are really, really rare, and it's like so scary to talk about it. And it's like having these conversations sometimes can really be scary, but these are really, really rare side effects. Do patients find themselves needing less Botox after getting Sculptra? Not necessarily, because when we're injecting Sculptra, we're really injecting on the mid to lower face, and most of my Botox dysport patients are injecting. We're doing your glabella, we're doing the forehead, we're doing the crow's feet, which is not really where we're injecting with Sculptra. So unfortunately, no. That would be nice. Let's see. Where specifically does the injection go on the face for nasolabial folds, right into that area, or is it used to lift? That's a good question. So you can inject it actually directly into nasolabial folds. We can inject deep down right here. So this is called your piriformis aperture. So we inject right deep into here, and then we can inject along the actual nasolabial fold. So then I usually fan it out along this area here. So you still may get a little bit of a lift too. With traditional hyaluronic acid fillers, I like to inject more so along the cheek line right here to kind of accentuate. And then I will inject into the nasolabial folds as well. So the thought process, like with laying the groundwork with Sculptra, is we kind of restore the volumization on this mid to lower face. Then we can go in with more traditional fillers, and if there's still a deficit, we can keep trying to build with traditional fillers. So there's kind of a role for both of them, if that makes sense. What is the average age that this has been tested for? So I think 30s to 60s. So even as young as 30s, women are starting to do Sculptra. And I feel like we're in the age of sort of like prejuvenation. So doing everything we can to be preventative. So it's absolutely appropriate for one of my most recent patients, I think was probably 36 when we were doing this. So 30s, 40s, but again, definitely appropriate for 50s to 60s. So there's not a rule that you have to be like 50 and above, but it's appropriate. I would say anyone from 30 to 70. Thank you so much for your time. Oh, you're welcome. Do you have any before and after photos? It's kind of hard to show you here, and we don't have any of our personal patient photos to show. You can go on the Sculptra website. I can try and show you. Like I have a little book in front of me. I don't know how well you guys can see this, but this is just from the actual Sculptra company. So you can see here, this is the before photo, and then this is 4 months after, 6 months after, and you can try and see here that she is much less hollow in those medial cheeks. Their fine lines and hollowing around the nasolabial folds is absolutely improved. She just looks younger, more youthful, less tired. Skin quality is improved. So pretty impressive results 6 months later. Okay. Can it make your face look fat or puffy? So when you first get it injected, you're gonna be swollen. It's a high volume of product that we are injecting, so you're gonna leave swollen. So absolutely, yes, for the first 2 days. After that, I don't think that it makes your face look fat or puffy. What it's doing, and if you were a candidate for Sculptra, that means that we're injecting it in areas where we're trying to get to restore that fat essentially and that hollowness. So I don't think that it makes people look fat or puffy. I think that all we're doing is we're getting that volume restored and it's giving a more rounded, youthful look to the face is really how I would describe it. It looks like it was me. Oh, okay. So saying after Google searching, it's mainly used in the buttocks and hips. So that is still, I think, considered off-label. So that at this point is not something that I do. But you're right. There are dermatologists who will inject it into kind of like we call what the hip dip, and then inject it into the buttock to help, restore a more youthful buttock, honestly. I don't do that, and it's still considered off-label. So, but you will definitely find injectors who do it. But it is on label in the face. This went through the FDA and is safe and effective in the face. And maybe one day the company, I don't know, maybe they'll do buttock and hips because it's definitely used. And there are other off-label uses as well where they use really dilute Sculptra on the neck, the décolleté. But again, I'm not doing that at this point. I'd like to stay on label for now. Does it help? Wrinkles around the mouth? Yeah, it does. And yeah, so these are our nasolabial folds, our marionette lines. So we can inject in this area here. I don't inject it into the lips or the fine lines around the lips here. So if you're talking about those sort of like radial wrinkles that we get around the mouth, no. But more of these folds here we can inject into. As far as blindness risk, if you were injecting near the mouth, would the risk be lower? Could it still migrate? So, so the highest risk areas for injecting filler are actually in the forehead. So if anyone ever wants to inject you in the forehead, think 1,000 times about it with filler, because that is where you have the highest risk of the blood vessels here being hit and then hitting an artery and then causing blindness. However, actually, we have an artery called the angular artery that runs right here. So I wish I could tell you that, oh, we're injecting here, so that means that we have no risk of hitting an artery that could supply the eyes. And unfortunately, that's not true. However, experienced injectors and injectors who understand facial anatomy, we do techniques essentially to avoid vessels. And we do something called aspirating, where we inject, we pull back on the needle. And sometimes it feels a little funny as the patient because you can feel me kind of pulling back, but I'm doing that because I'm actually looking to see if I get a flash of blood that would imply I'm in a vessel. And then we also do a technique that's called retrograde injecting, where I'm injecting and pulling backwards. So I don't inject and go forward because I could be injecting right into a vessel. When we're moving backwards, we're much safer. So the technique is important as well. How does it compare? Oh, and still migrate. Wouldn't the risk be lower, or could it still migrate to the eye? Yeah, okay, I think I answered that. Okay. How does it compare to microneedling? It's so hard to say because they don't do head-to-head studies on this. So I wish I could say, you see this improvement with microneedling, this improvement with Sculptra. So what I would say is think of Sculptra as it's going to help restore some of that volume loss, which we're not going to see with microneedling. And we're going to get some improvement again, glow, firmness, texture. And I think microneedling is a really great adjunctive treatment therapy to Sculptra. And that is going to be, we're going to do full face, right? So we're going to also target the forehead. We're going to target around the eyes, which we would not do with Sculptra. And with microneedling, we might get an additional tightness and a little bit improvement in, again, fine lines and wrinkles. So it's really hard to say. It's really hard to tell someone one versus the other. In a perfect world, we kind of look at the patient as an individual and we say, okay, how can we restore a more youthful appearance to your personal face? And based on that, we come up with a plan, and it may be, let's do a series of Sculptra. Let's restore some of that volume loss. Let's see how you look in 6 months. And then let's see, maybe at that point, we think microneedling is appropriate. So it really depends on the person and what's appropriate for them. But I love microneedling too. So it's hard. I can't pick one. So let me see. I think that was the last question I see here. Okay, great. So just a reminder that if you are interested, we're doing the special, buy 3, get the 4th vial free. I think that you're going to receive a text. As far as I understand, you text back happy if you'd like to be contacted for a consult. So we will have you come in to do a consult first, because again, we want to make sure that this is the right treatment for you and come up with a plan. But you'll still get that discount applied. It's a savings of $850. So it's a pretty significant savings. And you just have to book by the end of October. It was so nice to chat with everyone. Let's see, sorry, one more question here. How long typically would treatment take around the mouth areas? How long would treatment take? So the treatment itself takes about 30 to 45 minutes. And so I don't know if that's exactly what you mean, but yeah, we would treat more than, so with the vials of Sculptra, we normally would treat more than right here. We're going to be treating the medial lateral cheeks. I may inject some in temples, jawline, and we can inject around the mouth as well. But so again, the session itself is going to take 30 to 45 minutes. A lot of people come in early to numb, and then you're going to come back again a month or so later. We're going to do it again. So that's kind of how the process works. So just look out for the text message from us and text back happy if you're interested in scheduling a consult. This was so nice. And I look forward to chatting with you guys in person. All right. Have a good night, everyone.